Thank you for joining today's session, One Size Does Not Fit All, Advancing Access and Community Resilience in the Health Workforce. Please welcome Dr. Jonathan Cox, Vice President for the Center for Policy Analysis and Research at the Congressional Black Caucus Foundation.
Good afternoon. Thank you. Y'all got food you eating now? I'm sure people are hungry, feeling good now, so we can get that excitement up. We're ready. So again, my name is Dr. Jonathan Cox, and I am the Vice President for the Center for Policy Analysis and Research here at the Congressional Black Caucus Foundation. And I'm honored to welcome you to CBCF's 54th Annual Legislative Conference. Now, every September, CBCF really creates this vital platform to engage the most pressing issues for Black Americans and the global Black community. Now, the annual legislative conference is the largest policy conference that's dedicated to Black Americans. It functions as both a gathering of minds and as a catalyst for collective action. Now, this year's theme, Made for This Moment, Power, Policy, and Progress, calls us to recognize the significance in our role in shaping the present and the future. Black people have consistently endured adversity with dignity, often protecting and strengthening democracy itself in the process. Now, even in these moments of instability that we are going through right now, we remain committed to uplifting our communities, and by extension, lifting up all of those who are around us. Now, through this commitment, we create conditions for power, for policy change, and for lasting progress. Now, the Center for Policy Analysis and Research plays a central role in advancing the work of the foundation. Our team provides data-driven analysis, thought leadership, and policy recommendations that highlight both the barriers and opportunities for Black advancement. Today's session showcases that spirit. You will engage with thought leaders and practitioners whose expertise and advocacy are shaping conversations and actions across different sectors. We thank all of them for their ongoing efforts and their willingness to share with us here. I'd also like to take a moment to recognize and thank our session sponsor and partner, Johnson & Johnson. Let's give it up a little bit for Johnson & Johnson. Now, Johnson & Johnson is a long-standing partner and supporter of the CBCF and our work, and this is a partnership for which we are continually grateful. Now, beyond their monetary sponsorship of this important discussion, I also thank Johnson & Johnson for their ongoing commitment to issues of equity. Right? You all sit as models for corporate social responsibility, and through your continued work, we hope to see the elimination of disparities in health for Black people. Now, I have the pleasure next of introducing our next speaker, someone with a long-standing track record for legislative work in the areas of health equity, Congresswoman Jennifer McClellan. Absolutely. Congresswoman McClellan entered the U.S. Congress in 2023 and as a lifelong Virginia native, has served the greater Richmond area in elected office for nearly 20 years. Congresswoman McClellan is currently the chair of the Abortion Rights and Access Task Force on the Reproductive Freedom Caucus and serves on the Black Maternal Health Caucus. Please join me in giving a warm welcome to Representative Jennifer McClellan. Thank you so much.
We gotta make sure our technology works up here. All right, thank you and good afternoon. Is everyone having a great ALC so far? Yes. Great. Well, we know that we come together in unprecedented times where the issues we are talking about today are not new, but have been exacerbated by a number of different factors. We know that health disparities are as old as this country and the healthcare system itself. And we know that we began to make progress addressing these disparities, and then COVID hit. And that put a particular strain on our healthcare workforce that we were just beginning to understand. And then the second Trump administration, federal funding cuts, the decimation of our public health infrastructure, and all of the chaos, quite frankly, that has been unleashed in the past 9 months has made the stress on our healthcare workforce and our public health system and our healthcare system overall even more tenuous. And so I want to first thank the CBC Foundation and Johnson & Johnson for convening this very important discussion. I come to you as both a policymaker and a parent and someone who was a part of the sandwich generation and had to deal with and navigate healthcare issues for both parents and children, who is a patient, who nearly became the statistic of a Black woman who is 3 times more likely to die in childbirth, as my daughter almost became the statistic of a Black infant who succumbs to the infant mortality crisis. I served in our state legislature for nearly 20 years, where I sat on both policy and funding committees for our healthcare system. I was on the board of a state-run Medicaid provider. I was on the board of a state academic hospital. I was on the board of a for-profit hospital. I was in the state legislature when we expanded Medicaid. And so I've seen it all. And from day one, we have been dealing with the fundamental truth that the backbone of our healthcare system are its people, the healthcare workforce. And I'm highly cognizant as a student of history that much of our healthcare workforce early on in our country's history, that work was done for free or for wages that didn't allow those workers to meet their own needs. And that is still a critical component of our healthcare workforce. But we have also seen, with the rise of college tuition and student loans, and now with the big ugly law, a lifetime cap on those loans that means you will never be able to pay for medical school. But these are statistics, and I'm a storyteller. So whether it's, and I spent all of August traveling around Virginia to listen to stories from our healthcare providers and the workforce about what keeps them up at night. And whether it's the head of a nursing department who says, well, now that we are seeing diseases come back that we thought were eradicated through vaccines, I have to worry about what keeps me up at night is my nurses getting measles or other illnesses that keep them out of work. Or is it the long-term care provider in a rural part of my district who says, I am not only competing with long-term care providers in urban areas who can pay more, but I'm competing against Amazon for workers? Or is it the health partners or home care workers who themselves are on Medicaid because they can't afford health insurance? Or the hospital itself that is trying to figure out, when 17 million people become uninsured, what is that going to do to my bottom line? And through it all, we have to center the people. The patients, yes. The families, yes. But the backbone of our healthcare system are the healthcare providers and the people. So I'm here first to say thank you for convening this conversation and holding policymakers accountable. But I'm also here to ask for your help. Because it is very difficult in this moment to fully explain to the public what is happening in Washington and how it impacts their day-to-day lives. You help us do that. More importantly, it is critically important that I share and my colleagues share with our colleagues on the Energy and Commerce Committee, which covers healthcare, the Education and Labor Committee, which handles workforce issues, that we hear from you on a day-to-day basis. This is how your decisions in Washington impact my work in Nebraska, impact my work in Detroit, impact my work in rural, urban, and suburban facilities. And you help us make better policy. Because in a government by, of, and for the people, government reflects the perspective and therefore meets the needs of the people who participate. And for too long, we weren't allowed to participate. We, the people, didn't mean us in this room, many of us, most of us. But it does now. And part of that responsibility, yes, is voting, and I assume everybody in this room does that. Yes, it's convening for a legislative conference, but every single day you have an obligation to participate by making sure your voice is heard and you help us amplify that voice. So I'm here to say thank you, but let's dig a little deeper and do more, because this is an all-hands-on-deck moment where we have the opportunity not only to figure out policies to address the crisis we are in now and how to get through the next crisis that is coming, but how we rebuild a healthcare system that is better than what we have now, because what we have now is not working for everyone. Thank you all very much.
Please welcome to the stage Erica Jeffries-Purdo, Vice President of Strategy, Transformation, and Analytics for Global Corporate Affairs at Johnson & Johnson.
Well, we're warmed up now, right? Good afternoon, everyone. My name is Erica Jeffries-Purdo, and I have the privilege of serving as a vice president at Johnson & Johnson. I am so honored to bring greetings from our company and to say how proud we are to be sponsors of the Congressional Black Caucus Foundation's Luncheon on Health and Wellness. First and foremost, I'd like to thank the CBCF CEO and President, Nicole Austin Hillary, and her incredible leadership team. I want to thank them for their partnership and their championship of broader health workforce. I'm also deeply grateful to our members who are here today. Representative Jennifer McClellan, thank you for being here. Representative Bonnie Watson-Coleman, thank you so much for being here. Representative Herb Conaway. Thank you for your leadership, for your commitment, and more than ever, we thank you for your resilience. And last, but certainly not least, my thanks to our esteemed panelists who will be part of today's discussion. Our luncheon theme is One Size Does Not Fit All, Advancing Access and Community Resilience in the Health Workforce. This theme is deeply aligned with who we are at Johnson & Johnson. Since our inception 140 years ago, our purpose has been to advance health for every community. In fact, the third paragraph of our credo states, we are responsible to the communities in which we live and work, and to the world community as well. We must help people be healthier by supporting better access and care in community places around the world. And we must be good citizens, supporting health, education, and community well-being. Friends, these are not just words on paper. These words were literally carved in stone more than 80 years ago, and these are words that we live and we breathe at Johnson & Johnson every day. That responsibility to our communities inspires everything that we do. This year, like me, I know so many of you are reflecting on the 20 years since the Hurricane Katrina devastation in the great city of New Orleans. We were there, packing disaster relief packs in the aftermath of that disaster. As natural disasters come more often and with much greater intensity, health workers are among the first to respond and to continue to support communities long after the media attention fades. Health workers themselves need resources, they need training, they need support to do their job safely and effectively. At Johnson & Johnson, we believe that supporting health workers before, during, and after disasters is one of the most important investments we can make to build more resistant health systems and communities. And that's why this year we launched the J&J Care Community. It's a global platform that champions nurses and community health workers to expand access to quality care, addressing a projected nursing shortage of 4.5 million by the year 2030. We support and collaborate with community health centers, community health workers, national associations, and grassroots organizations. Our goal is to empower patients, to strengthen community-based services, and to support individuals to make informed decisions about their own healthcare. By supporting community-centered organizations with tools and resources to scale their impact, we can help identify and then implement lasting healthcare solutions. Already, in just 2025, we've impacted more than 650,000 healthcare workers, and we're on track to reach a goal of reaching 1 million by the end of this year. One of our key initiatives is My Health Can't Wait. Have you heard of it? We've been to your cities. We've been to Chicago and Cincinnati and LA and Dallas and Houston and Columbus and Detroit, and I could go on and on and on because I don't know about you, but my health can't wait. And I know your health can't wait. And that's why I'm encouraging you to visit our booth here at CBC. We are in the ALC Exhibit Hall D. I was going to say for Delta, but I'm not going to say that. But for Exhibit Hall D, and we're providing screenings, healthcare, resources, and education for all of you, not only here at CBCF, but in communities all across our great nation. So together, these efforts expand access, empower caregivers, and strengthen community resilience globally. So on behalf of Johnson & Johnson, we look forward to today's discussion and to continuing to advance community resilience together. Thank you.
Please enjoy your lunch. The next session will begin in a few minutes. Please take your seats. The session will begin momentarily. Please take your seats. The session will resume momentarily. Yep. Please welcome back to the stage Dr. Jonathan Cox, Vice President of the Center for Policy Analysis and Research at the CBCF.
Greetings again. Thank you. It's my pleasure to now introduce a couple of folks that are going to be joining me here. We have some additional members of Congress that will be joining us for a fireside chat. I'm gonna sit down over to see them and invite them up, and then we're gonna have a great conversation, just to get a little bit more into depth around the policy and the work that happens that is connected to this wonderful session, all right? So 1 second while I sit down and we'll get things going. Sorry. Here we go. I was waiting for this. All right, so first up we have coming to the stage, Congresswoman Bonnie Watson Coleman. Let's give it up. Now, Congresswoman Coleman is serving her 6th term in the United States House of Representatives, the continuation of a career in public service, advocating for the needs of New Jersey families and the equitable treatment of all people. The first Black woman to represent New Jersey in Congress, Watson Coleman is a member of the Appropriations Committee and Budget Committee. As the chair of the Democratic Caucus's Task Force on Poverty, as a House Democrat, Deputy Whip for Policy, and serves as a member of the Congressional Progressive Caucus's Executive Board. Thank you so much. Please welcome. You just either of those can sit. And then next, we're going to welcome to the stage Congresswoman Herb Conaway, or Dr. Conaway. Congresswoman Herb Conaway is currently serving his 1st term in Congress as the representative of the 3rd District of New Jersey. For 25 years, Dr. Conaway served the residents of New Jersey's 7th Legislative District as an assemblyman in the New Jersey Legislature. He chaired the Health Committee and served on the Budget Committee and Military and Veteran Affairs Committee. Dr. Conaway has played a pivotal role in advancing significant health legislation and modernizing public school nutritional policies. Please welcome to the stage Dr. Herb Conaway. All right. Thank you. I really appreciate both of you being here. It is an honor to be sitting with you all, and I'm sure everybody in this audience here is ready to glean much from what you have to say. And so I want to just start us off with a question to kind of get us at the big picture of things, right? And so what we know is that both of you have had long track records in advancing health equity and healthcare. And so from your perspectives, what are some of the most pressing barriers that Black and underserved communities face when it comes to accessing high quality, affordable, and culturally responsive care? And we can begin with you, Congresswoman. Yes.
Is this on? Thank you. Well, thank you, Johnson & Johnson, for always being in the right space, especially in New Jersey, and thank you for inviting me here today. And thank you for allowing me to be with my doctor, lawyer, legislator, Herb Conaway. So I think we have many challenges. We have challenges of access to health care because those facilities don't necessarily locate themselves in proximity to our availability. So we have transportation problems. We have job problems. We can't get off of our jobs in order to go seek health care. We have problems with having insurance for health care, but of course. And we have problems in that space as it relates to caregivers, doctors, nurses, assistants, aides, etc. And we have issues with them on two levels. One is that there are not enough of us that look like us, so that when we go to one of the healthcare facilities, if there is one that exists, or the hospital or whatever, that we get a chance to interact with somebody that we know has been educated and prepared for us. And the other thing is that sometimes we encounter people who don't understand that just because Black women aren't grimacing and bending over and unable to move, that we're in real pain. And that when we make a complaint about our health, it's a real complaint. And so there are assumptions that have been made because people aren't culturally ready, trained, to be able to address us and know us for the holistic human beings that we are. So those are some of the challenges that we have. I'm sure Herb, who is a doctor who takes care of people and makes sure that they live, has that is the idea, has much more to offer. But basically, it is access, location, insurance, cultural competence, and not enough people that look like us who are working in the field.
Absolutely.
Thank you.
Yes.
And thank you. And you must know at the state level, Bonnie was a leader in making sure on this cultural competency question, making sure we passed legislation in New Jersey to require that education among health care professionals, particularly physicians. And it's something that, as a resident, I have to say, I can remember some of these things stick in your mind when you hear them come out of the mouth of some, even 30 years ago, when you're in training, someone say something, well, this young man probably doesn't really have as much concern about his health as somebody else, or one of my fellow students or residents at the time, well, I don't know, maybe some people want to live on the street. I mean, that almost, that I got close on that one of biting my tongue. You really have, certainly there is a question of the lack of cultural familiarity, or just, I would say, a basic chip that allows you to put yourself in somebody else's shoes for an instant, and trying to understand that the heart beating behind the breast. And so getting at these cultural questions are very important. We also know, and if you're just coming through education, that many people who are working in nursing or as a physician, they have parents and family members who were working in those roles, and so they can see themselves as children, as youth, as college kids, taking on the role of a physician or a nurse or other worker in the healthcare space, because they have mentorship and they have the example of a parent or a close family member or relative who's doing that job, which is why in addressing these issues, we've got to make sure that internships are a much bigger thing than it was when I was coming through college. But this idea of exposure of youth to people who they can where they can see themselves doing that job one day, have a thought as they're deciding and ordering their steps in their education, to make sure, to understand the possibilities for their life, which is why, in the current administration, it's so tragic that we have an administration who is trying to take away things such as equal rights and equal protection. One of the things the Department of Education, just as an example, one of the things the Department of Education does is to make sure that if you are to bring a case against school systems after the data is gathered, to protect the civil rights of people in the educational process at the secondary school level, at the college level. These things are being pulled down. And it's a tragedy for those people who are growing and coming along and who want to pull this economy forward by actualizing their own lives, and then helping everybody else as they go forward. So policies, federal policies are very impactful in this, but being there, having experience, making that at the community college level, making it at the college level, having people such as myself and others who are in it, taking the time to provide mentorship. We do that in the Congress when people come. We do that. I've had opportunities to do that in the legislature and other spaces, certainly in the healthcare space. It's critical that take place, as well as all the other things you mentioned quite properly that are barriers.
Can I add to that just one thing that I thought about? Money, money, money. We need to be providing scholarships and supporting them, and we see a retrenching of that right now. But we need to encourage young people, as my colleague says, at a young age, to be able to have an interest and to get into this field. But we need to be able to provide resources so that once they get accepted, they can pay their way through college. Because that is an asset of value that is placed upon all of our well-being, not just theirs. Because back in the day, doctors used to make a lot of money. They didn't have to go through insurance or PBMs or their mothers or their fathers or whomever else. Now they got to go through so much, and they got to be taking Medicaid and Medicare, the reimbursements and stuff, and it's a different world. So when a person says he or she wants to go into this field, we need to find as many ways as we possibly can to facilitate that.
Absolutely. Those are such great points. Thank you. So before I was in this life as a person who works in policy research, I was an educator, right? And so I taught a lot of classes on race and racism, et cetera. And so we talked often about some of the barriers in the healthcare field. And so some of the things you all both mentioned really came to mind, like about some of the training that some of these newer doctors and physicians and other healthcare workers are getting, where these young students, right, college kids or med school students are still thinking that black people have thicker skin than other people, right? So the misconceptions continue. And so that not only has implications for patients, as you all talked about, but then also for the other physicians. Imagine being like you, Dr. Conway, right? A physician in training, and hearing these negative stereotypes about black people or people of color, and having to bear that burden as a person of color yourself, right? And so that makes me think about the issue of mental health, which is one of the things that we're here to talk about today. So I really want to turn to you, Representative Coleman, on your own work around issues of mental health. And so I know that you have been a leader on these equity issues, introducing things like the Pursuing Equity in Mental Health Act and launching the Congressional Black Caucus Emergency Task Force on Black Youth Suicide and Mental Health. And so how do you see the lessons from that work informing strategies to support the mental health and well-being of healthcare workers, especially those that are serving in these underserved communities?
Hi, thanks for that question. So when Facebook was really a vehicle for which you got information, and you weren't swayed to be for or against anything, you just got information, kept seeing these stories about young people, 5 years old, 9, 12, thinking about suicide, committing suicide, parents crying about what their children were experiencing or having done. And I said to my staff, I don't know if this is real or not. We need to look into this, but this keeps coming up on my Facebook page. So we looked into it and realized that those were real stories. And I said, well, we can't fix everything, but we can damn sure elevate this as an issue. And so we, with Karen Bass as the chair of the Black Caucus, we put together this emergency task force. And we said emergency because we didn't want it to last forever. We wanted it to do its work, get on with it, and come up with some ideas. We did it. We had a group of psychologists, psychiatrists, social workers. Herb was a part of that group, that working group. Out of that working group, we had a series of hearings. After those hearings, this group got together with our people. We put together a pushing a report sounding the alarm, which identified all the sort of gaps and problems. And then we put together a piece of legislation, and that's the legislation that he was talking about. That legislation was supposed to create greater education, greater elevation, greater training, greater access to mental health services and health in communities, helping with the stigma, particularly in the Black community. We grew up, if we were Christians, Jesus got it. But Jesus got it so that he put people on earth who could get it and help us. And we needed to make that link for them. And so we worked with clergy and other organizations. Now, what's happened as a result of it? The legislation in its fullness, which is like $1 billion worth of support to various issues, has not gotten passed yet. But pieces of it have been incorporated in other pieces of legislation. So we have additional research for Black studies, for minorities in that area. We've got some stuff for the community and all, but not nearly enough. But what we do have that we did not have before that is there is constant conversation on the Hill in many different committees now about mental health in the Black community, mental health in the youth community, mental health in the white community, mental health in Congress. You know, it doesn't matter what your title is or what your job is. You may be having that experience, and we need to destigmatize it. We need to put resources into it. We need to make sure that our young people in particular are touched when they are young, and we understand that bad behavior, in quotes, is not an indication that a kid is bad. It could very well be an indication that a kid is traumatized. And so we need to be able to do that kind of rescue, or triage, I guess that's what you call it, Doc. And that's what this bill thus far and this work has done. It has elevated the discussion. We need people to keep pushing us, pushing Congress, to put your money where your mouth is. Because we know sometimes Congress speaks, but doesn't move. It's beyond praying, it's about doing.
Indeed.
Or the money is allocated and then the president doesn't actually spend it. Yeah, thank you for that. It is as a result of that work that sprang from a body of research that's been developed by African Americans, others focusing on the challenges in the community that led to the data set that helped bring so much of this forward. At the state level, I passed legislation to begin to require the schools to screen for mental health issues, and we know that many schools have started to develop within the school cadres of teachers to look at this question of what's going on with mental health, because a couple of things. One, if you identify through screening a child that has an issue, you can fix it early enough so that it doesn't impact negatively their educational attainment, which we know is key to their future economic, development as an economic actor in the society. 80% of those diagnoses that are found can be treated. And so that's very critical. Schools need to be funded so they can do these additional programs and to make sure that kids can be identified and their issues can be addressed. I'm a big believer we ought to be putting health centers in the schools anyway. There are countries that are doing this to deal with not only certainly the mental health challenges, but physical health challenges. You know, you've got a parent who's working, they're very busy. If you can take care of stuff in the school, that will make life easier for that parent. And so, very important to get on top of things. Dental health as well, by the way, causes a lot of absenteeism in school. Co-locating these services to make it easier for people to access them is critically important. And I know you want to get on to other questions. I think as a society, we must begin to address the challenge of social media and its impact on our kids.
Absolutely.
You know, if you look at the world and see the rise of broadband, you see a concomitant rise of mental health illnesses, mental health problems among the cohort that's exposed to this social media. And we've got to figure out a way to empower parents to be more proactive in protecting their children. I think we're going to have to look at the regulatory landscape to make sure that our children are protected. We're hearing more and more whistleblowers coming out and talking about how these algorithms are designed, what they are designed to do. The fact that they don't allow their own children on these platforms should be very telling to all of us. And it's something we're going to have to take on in spite of the economic and other financial incentives that are driving the action of these platforms that, in my view, I think there's just increasing evidence is very harmful to our children and their development. We have to be much more intentional about dealing with this important challenge.
Indeed, absolutely. So as we start to wrap up, I want to ask one last question of you, and that's with regards to public trust, right? So we know that public trust in institutions generally right now, whether that's healthcare, the government itself, everything, right? It's a persistent challenge. And so given your experiences, the both of you, what role do you believe elected officials can play in helping to rebuild that trust? And then how does that connect to strengthening the health workforce?
Well, I'll start with some of this. I'm been and am involved in clinical trials work, and certainly and happen to be working in public health, nothing like Tommy Conway, to take on a public health role and as the pandemic swept across the world and into our state. And providing information that allowed people to understand what was going on, that information was, validated the best that we could validate it at a time when we were dealing with a virus that was novel, where its biology was not completely understood, but giving people information on how they can protect themselves and their family are very critical. It's important if you are in a position to be able to speak on these issues, if you're a governor, you're running a Department of Health, you're a physician in the legislature, making sure you're absolutely grounded in what you know and sticking on that ground and defending it is critically important at times, at all times, particularly in times of things like a pandemic. We are facing a serious challenge today, driven by the White House once again, driven by a man in RFK Jr. who has no business running a health department, who said no one should follow my advice on health care. He's absolutely right, because I will tell you he has caused more damage and will continue to cause damage on vaccine policy, on preventive health policy, on defunding the important research and information that needs to be brought to bear so that we can bring forward the kind of public health system protection for individual health, community health, and deliver the treatments that have driven down the scourges of mankind across the world. We are moving away from our leadership in this area as a result of this man and his policies. They're defunding brain cancer research in children now. Can you imagine cancer research, which is a frightening thing for everybody? We're actually walking away from the table. The best and brightest are going elsewhere to do their training, to get their PhDs, to do the research. It is a tragedy that we're watching as we go forward. The other thing we must do, and I sat in meetings like this online, and I'm going to say it, I've said it before, the past should inform our steps, but the past is not necessarily present. I've heard people too often mention the Tuskegee experiment, and this makes its way across the Black community as a warning to be careful and to be skeptical of the information that trusted healthcare providers are providing to you. Tuskegee cannot happen today. I do clinical trials. The number of eyes, the regulatory system around clinical trials, as an example, are beyond anything that was present at the time of the Tuskegee experiment. And people of color, women, need to be in these trials. The medications that will come forward, the information about them and how they work will be developed in a way that makes sure everyone is accounted for if we are in it. And if people are not involved in these trials, and thank goodness so far, the Eye of Sauron has not, said, don't worry about putting people of color in these trials. Thank goodness that hasn't happened yet, because we need to be there and we need to speak truth to people about the current state of research and how that works. There are just far too many protections for anything like Tuskegee to happen today, and we need to say so as leaders.
Absolutely. All right, last word to you, Congresswoman. How do we help to rebuild this trust in the
I
institution?
so rarely disagree with my loved one here, but I don't know what's happening in prisons across this country. I don't know what kind of examples of service or lack of service or ignoring or placing in harm's way folks who don't have folks looking after their interests every day. I agree that Tuskegee can't happen the way it happened, but I can believe that people who are not being cared for, checked in on, and accountable for can be used as guinea pigs. And so I think trust is very important. I think that we need to encounter what's happening in our various prisons and our immigration detention centers as we are trying to do. I think we need to push back on the RFK, who is probably the most disappointing thing I've ever, a person in government right now other than the president, but I think trust is something that our community expects from us. So I think that we recognize the connectivity of all the things that are happening right now and all of the distractions that are happening so that we're not paying attention on what's being done to dismantle government, to dismantle services, to take away health care, housing, and everything else. I think that all the crap that we have to respond to on a daily basis is a form of distraction. And I think that Black folks better be consistently there in voice in such a way that Black people across this country say, I trust him. What he says, I believe. I trust her. What she says, I believe. It's our responsibility to look out for our community from the inside and define ways, Jen, that we communicate with them on the outside so that they are informed, they are mobilized, they are ready, and they are pushing back, and they are demanding what we all should have in this country, which is the right to vote, the right to speak, the right to live, the right to thrive, and the right to have peace in our communities. And so that's my role, and I believe that's the role of elected officials, and that we will work with the people who are the professionals in the specific fields that are being challenged, science in particular, medicine, and everything else, and make sure that our community's voice is heard. Because if our community's voice is heard and you get mobilized and you recognize that you may be okay, but you know somebody who isn't, it is our responsibility to do for those who are least among us. Giddy up, show up, speak up, and stop it.
Hey, that's where we're going to end it. Thank you so much. I appreciate it. Everybody continue to clap for Representative Herb Conaway and Representative Monty Watson Coleman. Thank you so much for joining us.
I know, I'm about to. Jenny, I just wait. Please take your seats. The next session will begin momentarily.
Oh, okay. Nice to meet you, Raina's friend. Ria.
Please welcome back to the stage Dr. Jonathan Cox, Vice President, Center for Policy Analysis and Research at the CBCF.
Oh, no. Okay. There we go. All right. Good afternoon again. I'm so excited to welcome to the stage our next moderator for the next portion of this session, Dr. Ashley Stewart. Yes, absolutely. So Dr. Ashley Stewart serves as the American Institutes for Research Health Equity Fellow at the Congressional Black Caucus Foundation. Her research focuses on the intersection of mental health, education, and technology, with a particular emphasis on structural environmental factors that shape the lives of Black people. She has worked with community organizations and consultant programs such as the Equity and Mental Health Initiative with the Steve Fund, where she has conducted community-driven research and provided data-driven recommendations that guide strategy and inform equitable policies and practice. Please join me in welcoming to the stage Dr. Ashley Stewart.
Thank you so much, Dr. Cox, for that introduction. Again, my name is Ashley Stewart, and I am the Health Equity Research Fellow here at CBCF, and I cannot be more excited for this panel and conversation that we're going to have here today. We have with us here some very esteemed panelists, and I'm going to tell you a little bit about them before we jump into our conversation. Is that all right? All right. So first up, we have Dr. Jasmine Marcellin, who is an associate professor of medicine and infectious diseases. She is also a director on the Infectious Diseases Society of America Foundation Board of Directors. Dr. Marcellin is a nationally and internationally recognized scholar focusing on reducing health disparities in infectious diseases and antimicrobial stewardship, building and supporting a diverse healthcare workforce, effective communication, and authentic community engagement. Let's give Dr. Marcellin a round of applause. Next up, we have Reverend Kimberly Williams, who is the president and CEO of Choose Healthy Life, a leading national nonprofit dedicated to addressing health disparities in underserved communities through partnership with the Black Church. Appointed as Choose Healthy Life's first executive director in May 2023, Rev. Williams combines a unique 30-year track record of executive roles in the corporate sector and over a decade of ministry service to lead the organization's mission to integrate faith and science to confront and resolve health equities. Let's give Reverend Williams a round of applause. And last but not least, we have Ms. Aisha Williams, who is the global lead of healthcare workforce strategy and programs for the Global Health Equity Organization of Johnson & Johnson. In this role, Aisha drives the development and delivery of strategies that support nurses and community health workers, addresses care gaps, and deliver better health outcomes for patients globally. Aisha's passion for transformational patient impact has driven her career across diverse organizations and leadership assignments throughout the world. Let's give Ms. Williams a round of applause. All right, so let's get into this conversation. I'm super excited for what will be an engaging and conversation in such an important topic. So let's begin by setting the stage. Even after the peak of COVID-19, many communities still face barriers to high-quality, culturally inclusive care. From your perspectives, what are the biggest challenges threatening both workforce resilience and community access today? And that question is for anyone.
Okay. Okay, so I don't have to press anything. So I think that there's three big priorities that I can think of. The first is the growing difficulty in recruiting and retaining healthcare professionals across all of the different healthcare sectors. I'm a physician, but what I can speak to can still be seen across nursing, across other allied health professions. And there are a lot of different factors that are responsible for that, including things like the cost of going into health profession schools, like was discussed earlier. For physicians, there is a significant degree of debt that you accumulate when you are going through this pathway. And then depending on what specialty you choose, if you choose a more cognitive specialty that does not have a procedural component to it, like my specialty, infectious diseases, reimbursement is actually less. And so what people are looking at is doing extra training for less reimbursement.
Good afternoon, everyone. And thank you to Johnson & Johnson for this opportunity to be here today. When I think of the barriers, I would say number one is fear. Number two is cultural competency. And number three is access. And so our model was very instrumental, Choose Healthy Life, by addressing fear through the education of health navigators and making sure that they had the tools that look like them and could be understood by them and brought them into the community to be able to help those who had fear. The second thing was access. We were able to bring access through our churches. We have a intersectionality of faith leaders in science. And so we were able to bring our work into the community by partnering with our churches of faith. And I'm so proud that we have one of our board members here, Congresswoman Dr. Donna Christensen is here. So the intersectionality of faith and science and that access. And then last but not least, the ability to make sure that navigator connected the person to care and continued that journey forward.
I would add to that there is a lack of appreciation within the workforce and a sense of value and pride in the role. I know that during COVID, we all gave appreciation to healthcare workers, but we're sitting here on a crisis that we just don't realize we have. We have 1 in 4 nurses in the U.S. who say they plan to leave care in the next 3 years. We have community health workers who are some of the closest to the community. They're there, they live in the community, they know the community, but most of them are underpaid or unpaid. They don't feel they don't feel a part of the health systems that they're in, and so that's why so many people are leaving care. So we have a job to do to not only tell healthcare workers thank you, but to help empower them, to speak to legislators, to speak to health systems leaders, to bring them forward as not just caregivers, but leaders who have some of the solutions that we need. And we hear, as we speak with healthcare workers across the country, that when they feel that sense of support in true financial support, scholarships, other things that were mentioned, it makes them want to stay, and it helps other people see that as a beacon and a career that they want to be a part of. And we need that to help address this shortage.
Thank you all for those answers, and I think we're hearing some recurring themes even from the previous fireside chat. So what you all mentioned are the cost of education for potential physicians and people who are pursuing their work. We're also talking about a lack of access to resources and a lack of appreciation for the healthcare profession in general at this moment. And you bring up that point, Ms. Williams, and it leads us right into our second question, so thank you for that. And so building on that foundation, projections actually show a shortage of more than 100,000 healthcare workers by 2028. How can we address these shortages in ways that strengthen equity rather than deepen existing disparities?
And health workers are special. So we trust health workers with our lives. In our most vulnerable moments, we are looking to them, and we have to show up for them too. At Johnson & Johnson, we're very proud to support healthcare workers through what was mentioned earlier, our new social impact platform called J&J Care Community. And we have to support them in many ways. We call it our ACE framework because companies love acronyms, but we call it ACE. And it's our work to advocate for, to connect, and to equip health workers. So we advocate for them by letting not only them know the job that they're doing, but as I mentioned earlier, health systems and professionals and those who are making the difference, to show them as the leaders that they are, to reinstill that sense of pride. We help to connect healthcare workers to the people in the community who really need it. Often we find that the healthcare workers, or especially the specialists who are dealing with certain types of care, aren't immediately with the community that needs that. A lot of community health workers spend over half of their time on paperwork, so they're not freed up to be in the community. So we work with technology partners and others to help to connect the dots and bring the health worker and the community together. And then we help to equip. Healthcare workers spend a lot of time giving, but what are we giving to them? So we help to give them resources and training and leadership and innovation to help them to grow in their career. Because when health workers see a career path, when they see areas to grow, again, it makes them want to stay. And so it's a whole solution of us letting that healthcare worker know that we see them. And when they feel appreciated, when they see a path to continue to grow, they're gonna give us more high quality care that our communities need and that we all deserve.
If I can add, so 2 other things that come to mind. Thinking about what the state of the healthcare system is right now, and places that really are struggling because of lack of resources, who may be underserved, the cuts that would be happening to Ryan White funding, to federally qualified medical centers, all of that are things that potential healthcare workers are looking at and seeing their, potential future colleagues struggling and thinking, I don't know if I want to go into a system like that. And so if we're continuing to advocate for, reversal of cuts, for putting more funding into these medically underserved areas, into caring for the folks who are the most vulnerable in our community, then the people who are considering this might think, okay, so this is valued. This work that I want to do is valued, and so I'd like to go down this pathway. And then the other thing is when we're thinking about who are our folks who are trying to get into this pathway and how much it costs, what are the options for us to help with better loan forgiveness and public service loan options, which are really good pathways to demonstrate that this is valuable work that we want to support you to go into it.
I think I'll do a last build on that, right? When we talk about our houses of faith, we have what I consider convening power. We're able to bring all of those voices together to have a conversation and build out a model that brings the resources to the voice and to the people that need them. A lot of times having the access means I need you to show up where I live, where I work, and where I play. And our work is also a work that helps those health navigators, and it helps them to be able to support the community by minimizing the need to choose. If I have to choose over whether or not I can pay my bill, keep my lights on, feed my children, our work helps that health navigator have the support by addressing social determinants of health, because our events always meet needs, and we bring the access to care into the church. And so they don't have to go far to get their comprehensive screenings. We bring the screening to them and then connect those participants to care.
Thank you, Rev Williams, for bringing the community in the room. And so we're going to stick right there for 1 second. And so can you talk a bit about how can these partnerships with faith leaders and trusted community voices be scaled to expand access, build trust, and support patients and providers in underserved areas?
I think one of the first things we can do to scale it is continue to be intentional about a message of prevention. A lot of the times, our communities are addressing their health needs through the emergency room. And so I think we make it scalable by providing more access to preventative care, to helping them find pathways on the front end, and bringing the education and the knowledge and the awareness to the table. Our founder founded our organization as an answer to COVID. And as you remember, everyone was scared, everyone was afraid. And she she basically allowed the church to come in and say, hey, we need our pastors. How many of us know when a pastor stands and says, you do a thing, you do a thing? And so our pastors were instrumental because they took the shot in their arm first. When a pastor stands up and says, your health matters and your health is important, guess what? The entire congregation moves in that way. But the intersectionality of faith and science is around our health navigators, because I believe they speak what I call a unique language of love and science into the space. And so as faith believers, we use what I consider to be a discipleship model, where you got to be willing to support and stay with that participant until they're ready to step into the journey. And so I think one is preventative care. Two is the access to that care, making sure that we bring more and more resources into the community, making them educated participants, right? We were able to educate our participants to say, here are your options. Here are the COVID options. You can get vaccinated, you cannot get vaccinated, and here are the types of vaccines. We are empowering the community to say, you have a choice, and we'll give you the education, the knowledge, and the awareness to make that choice. And last but not least, I think we need more cross-sectional collaboration. We need to continue to bring our faith, our clergy leaders, our community leaders, our corporations, and our community organizations to the table and say, we cannot do this alone. We all have to do this together.
Thank you so much for that, Rev Williams, and thank you for bringing up the points around collaboration, and I think each of you bring very unique perspectives here. And so with that being said, let's turn to medical education and the professional pipeline. Dr. Marcellin, as someone who has championed inclusion, diversity, access, and equity in medical education and professional societies, what practices or policies have you seen most effectively improve the well-being and retention of healthcare professionals from historically excluded groups?
So this is something that is really near and dear to me. I sort of live and breathe building the next generation in healthcare. And so I'll start with stories, okay? I like the theme of stories, they resonate. And one of the stories that comes to mind when I think about this question is a couple years back, I was interviewing some candidates for internal medicine residency. And the candidate that I was speaking to said to me, you know, I looked at the website and I saw you there. I wasn't sure about, you know, Nebraska, fair. But when I saw that you were there, I thought, oh, okay, so there's somebody who is like me, who is not only, you know, a black woman in medicine, but this is a black woman in a leadership position. This is somebody who is committed to teaching people like me. And so maybe this is a safe place. And this is what that person told me in an interview. Right? And I've had that same conversation with the trainees that I've recruited to our program. And what they say is the thing that they need is they need support and they need mentorship. Because there are only about 5% of physicians in all specialties. In my specialty, probably about 3% who are black. And you know, black women, about 2%. As you look at the number of women black women, for example, who are at the professor level or associate professor level, those numbers go down. So we're walking around and you're not seeing people like you in those spaces, and you're questioning whether or not you belong based on what the different institutional culture is. So coming in and having that mentorship from the beginning is really key. But then there's also the things that need to be done to cultivate the mentorship. So people need opportunities. It's not just somebody to have a good conversation with and a nice chat. What are the things that we can do to help advance these folks to make sure that they can be successful in their careers? So something that I do personally is when the residents or the students or even pre-meds are coming to me, I sit down and talk to them about what they're interested in. And then we try to develop some sort of scholarly activity, research, a paper, something that they want to present that they're interested in, but that I can help support them. And so now they can add these things to their CVs. They can say that they've had these opportunities because somebody took an interest in them. These need to be happening from not just at the time when they're in the medical school or in residency. We need to be doing this way before, because the time frame from when children decide that they could be a doctor to I can't be a doctor happens somewhere around 4th grade. So we need to be back into the elementary schools. We need to be showing them that you can do this. You can go into a healthcare professions. This is something that I participate with all the time, going in and talking with the young kids. And then the last thing that I would say is, and I'm glad that this was brought up in the fireside chat, talking about what is the curriculum like. How are we teaching all of our healthcare professionals to care for people from minoritized communities? How do we teach them to care for all of our patients with empathy through a lens of equity? That is something that should be just, it goes taken for granted, but it's not. It has to be taught in this day and age. And so I've developed curricula that helps medical students, that helps residents to understand how to navigate different cultural needs and what the importance of interprofessional collaborations are to help make our patients care better. But we really need to do all of these things in the medical education space in order for us to be able to develop or create a workforce that is prepared to care for everybody that comes through that hospital or that clinic, or else we're going to be in trouble.
Thank you for that answer. And I think what you're talking about is a multi-pronged approach to this. And I appreciate you bringing up mentorship. I think that's one thing that really resonates with me, even in my own training as a PhD. I have mentors in the room now, and that can't be understated. So thank you for that. Ms. Williams, let's zoom out a bit. I think that we've been talking a lot about what's happening in our own communities, in our own backyards, in the U.S. context, but let's think globally. So in your work, in your leadership role at Johnson & Johnson, you focused on strengthening the nursing and community health workforce worldwide. What lessons from global workforce strategies can be applied here in the U.S., particularly to support Black communities and other underserved populations?
I love what the doctor said about the magic when somebody has an idea and they just need the support to bring it to life. I think that helping to fuel healthcare worker-driven innovation is one of the most impactful and powerful things that we can do to change care. I keep looking at this sign on the wall, made for the moment. The healthcare worker is made for the moment. When you think about it, nurses and community health workers across the world spend more time with the patient often than anybody else. They see the challenges, they see the problems, but often they're not given a seat at the table, and they don't have the skills to know how to bring their ideas to life. And that's one of the areas that we try to play as J&J. Some of our global programs that we apply here in the U.S. is our Nurse Hack for Health, where we bring together our resources, technology companies, partners, IT professionals, engineers, and put nurses and healthcare workers through an experience to be able to take their ideas, what they know will make a difference, including in underserved communities, and actually bring it to life. And then there's a pitch-a-thon where they're able to bring their ideas to a panel, and the winners of that pitch-a-thon are given several hundreds of thousands of dollars to go and to bring their idea to life. We also have an annual nurse fellowship that likewise gives nurse leaders paired with nurses who are in the hospital system access to those same types of skills. And just to bring it to life in the spirit of a story, there is a phenomenal nurse. Her name is Yvonne, and she's from Ghana. And her sister-in-law passed away in Ghana because she had undiagnosed heart issues, which is disproportionate to Black women and is the leading cause of maternal mortality in Ghana. She had a simple idea of how community health workers all across the country and in rural communities could take a sun-powered ultrasound device, and that when those healthcare workers are out caring for the baby, they can just move it up and look at the heart as well. And this has the potential to cut maternal mortality in half in Ghana with untold benefits for the continent. What idea is sitting out there from a health worker in our communities to help our elderly who may not be able to get out to the doctor? to help mothers who have children with special needs and they may not know exactly where to go or what to do. Those ideas are there, and part of what we can do as the broader community is help to equip them, to give them skills, to give them resources, to bring it to life. And that's how we take the global solution, the US solution, my neighborhood, your neighborhood solution, and really make things happen for community.
Thank you so much for that. And I appreciate all of you for being here today, offering these very unique perspectives. And so as we think about wrapping up, let's look toward action. What is one concrete step our audience members can take now to advance both access to health and healthcare and resilience in the health workforce?
Well, we're here in DC, which is great, right? So we've all got, whatever state we're from, we've got representatives, we've got offices in the Senate and in the House that we can try to have conversations with and talk to them about what the issues are. When we think about workforce, there are so many opportunities for our elected representatives to help with pushing this issue forward. So for example, the healthcare biopreparedness workforce pilot program is something that is currently in the works. This will help with loan repayments. This will help with getting those resources for healthcare workers who are going to be doing infectious disease related or HIV related or other types of biopreparedness work out into underserved areas. That is just one possibility, but as part of a larger workforce preparedness act. And so if we can have our representatives be thinking about this, trying to get it authorized and then funded, this will help us to be able to support the incoming workforce.
I think the one step that I would like to share with the room is that we have to own our health. We can do none of this work without our health. And so we have to be very proactive in ensuring that we are doing the preventative care that's necessary. And our way of doing that is that we provide an at-no-cost resource called the Blueprint for Wellness through our churches. It's a comprehensive blood draw. And then once that blood draw is taken, you receive a full booklet where each of the blood draws are defined and you find out exactly where you fall on that scale. Our health navigators take the perforated page on the back of that booklet and ensure that our participants are connected to care. All of the work that we've been talking about today and throughout this week cannot be done without your health. And so if we're not intentional about knowing where we stand from an overall health perspective, then we will be no good for the journey. And so my hope is that we will continue to own our health. That's a step. I got to give one more, is that we continue to do this collaborative work together. And last but not least, that we always remember that when God is with us, there's nothing that we cannot do. And so we have to continue these very important conversations that help us bring all of the voices together to move forward.
I want to speak on that, bringing all the voices together. I would say two things. Number one, bring healthcare workers to the decision table, but let's meet the community where we are. One of the most powerful collaborations that I've experienced recently is our Johnson & Johnson My Health Can't Wait. And I have to speak to it because I have members here in the audience of my team who spend every single weekend out in the community. I was in Columbus, Ohio a few weeks ago with 35,000 members of the community who came out to a health and wellness fair. But it wasn't a health and wellness fair. It was a celebration. It was a family affair. There were dozens of people standing in line to be screened for blood pressure, for HIV, for prostate cancer, as if it were a concert. There were little plastic chairs set out across these screening areas full of Black men, biker groups who had come together, laughing and joking as if they were just at a family affair, but they were waiting in line to have their health prioritized. There was a community walk with a wonderful little youth group, a drill team and a youth drumming group. It took me back to the days when I was on the drill team in my community. That's what health can be when it's the corporation and it's the local health system and it's the nurses and it's the church. That's what makes a difference. So I think what we can do is bring the healthcare worker, because that's where my heart is, but let's all work together to make health something that people are excited to be a part of, where we are there in their community to take away the fear, to take away the stigma. It is possible, and it can happen when we work together.
That's a great word to end on. Well, we have our marching orders. This room is full of folks who are passionate about healthcare. I've seen the invite list, so I know we have some major players in the room in the healthcare space. Can we give our panelists a round of applause? So let's make sure we take everything we learned here today in this room, outside of this room, into our communities as you navigate the rest of ALC and into the week as you move through your own communities. And you all have a great rest of ALC. Thank you for coming.